Good afternoon, everybody. It's great to see you all today for our online webinar session. I know a lot of you in the room, so hello, but the people that don't know me, my name is Victoria Brown. I'm the Managing Director of HPC and also our award-winning piece of software for HR and health and safety, OneHR. The subject title today is Creating a Safety Culture. So as I'm sure a lot of you are aware, and one of the reasons why you are on the session today is that health and safety really is in the spotlight more than it's ever been before. And as business owners, we are responsible, obviously, for our workplace and for our people. There's a lot of organisations that have been at home for 16 months and soon will return to the workplace. Lots of people are anxious, lots of anxiety, lots of fines at the moment being issued. So we thought it was a great opportunity to bring our expert Colin Jones, who's our health and safety consultant, to talk to us a little bit about how to create a safety culture. He will give you the opportunity a little bit later on to ask questions. If you've got any questions, we are on record, just to let you know, so we've got it on record just for anybody that can't join today. We will send it out to all the members of the peopleHUB and clients. But if you have got a question that you'd like to share or ask Colin, you can either pop it in the chat and I can ask it for you, or pop just in the chat, raise your hand that you'd like to speak, and we will unmute you at that point and you can ask the direct question to Colin. So I'm going to be quiet now. I'm going to hand it to the expert. Quiet for once. I'll do my best. I'll put myself on mute. And Colin, I'll hand over to you.
Thank you. Good afternoon, everybody. Welcome to this webinar. And as Vic has said, it's about creating that safety culture within the organisation. I think more ever now, especially now as we're moving out of what is these COVID restrictions and into a normality. Following the pandemic, I think what the pandemic has done, and a lot of business owners have recognized this and have actually stated it, and we'll show some statistics about it regarding the health and safety has become very prevalent now, and the needs to meet health and safety needs are more and more important. And it's extended away not just for health and safety and on a traditional physical risk element, but it's also about well-being and the mental health issues that surround people who've been working remotely, etc. So it has extended to that, and a lot of businesses who ordinarily you would think traditionally are low risk in terms of health and safety are all now having to sit up and take notice. And it's with that in mind and looking at the way HSC and other health and safety bodies are looking about, and it is about creating that culture where everybody buys into the health and safety, and this is the whole point of us having this session this afternoon. I'm saying this morning because I thought it was going to be 10 o'clock this morning. I panicked everybody thinking it was 10 o'clock, but there we are. So if you could just go to the first slide for me, Dan, please. Yeah, so just as an introduction, it is about the emphasis in the workplace now about, and where it used to be, quite traditionally, the larger organizations would look at cultures and look at systems and processes in that. That is cascading down more and more now to small to medium-sized businesses. And because of that, you've got to look at what are you doing? What is your provision? Are you fit for purpose? Is there this buy-in into a health and safety culture? And what it is you may need to do to make those changes. There are some definite business benefits for creating a safety culture within your organization. It helps with morale, it helps with absenteeism, it can have a positive impact on obviously reduction of work-related illness and also accidents as well within the workplace. So, it does have those tangible benefits. It also has the benefits in terms of your business and how you project yourself externally to potential clients and potential customers. If they can see that you are an organization that really does look after you, look after your staff and consider their well-being and look at their their welfare in that regard, then I think it goes a long way. Just as an aside from that, just as the craft brewery Brewdog is a great example of that. They've had this exponential increase in business, but they've come into the public eye for all the wrong reasons, because of this open letter that the staff said they were treated poorly, and they weren't treated very well at all. And as a consequence, their crowdfunding investors are considering pulling out now. So it can have a massive impact if it's not done right. But as I say, it's now cascading down to the smaller businesses. And I think small businesses now need to take a leaf out of this book and understand that with all your employees coming back to work, you might need to look at how your business is operating, what changes you might need to put in place that will embrace this kind of thing. So yeah, creating the right culture for your business is becoming more and more vital. So from leadership, planning, implementation, and reviewing what you've already got in order to enable you to control the safety measures within your business, I think is becoming more and more important. And as I say, in terms of compliance, morale, and reputation, it very much is at the forefront. And it then should then cascade down to the fact that you as an organization can get everybody's buy-in to it. Employees then can feel that they are playing a major part in making sure that safety culture is embedded within the business, and they themselves then feel much more comfortable, and communication is open, and change is more relevant, and everything is as I say, at the forefront in terms of safety being first with everything that you do. Could you go to the next slide, please, Dan? So in more recent years, there's been a significant focus on the workplace culture and how many employers think about health and safety as the core drivers within the organization. As I said, it was traditionally a lot of larger organizations, but we're working now with more and more smaller businesses now who are seriously thinking about how they can implement this and how they can integrate it within their usual management structure or their management systems that they have. And just as that statistic says at the bottom of that slide there, 78% of business owners say that the level of health and safety risk has increased following the pandemic. So it sort of highlights that, it has put things very much into the focus. And as Vic said, that, health and safety now is more prevalent. The HSE are probably more visible than they have been in recent years, visiting organizations. Yes, they've come in under the auspice of COVID-19 and whether you're COVID-19 safe, but they're looking more deeply now into terms of what are you doing about and how you're managing your health and safety within your organization. So yeah, it is very, very important to factor this in now in terms of how you move forward as a business and what is primarily good business practice. Next slide, please, Dan. So how are you going to go about creating a safety culture? Well, it's got to be led by example, as the first point would suggest there. And it needs to be done in such a way that leaders do buy into this, and it's demonstrated that safety is being taken seriously, and it is at the forefront of everything you do before anything else is done. So yes, it has to be transparent and it has to be believable by the leadership. Otherwise, you're falling at the first hurdle, basically. So you need to factor that in and consider that. The second point, risk control and compliance. Again, yes, you have to be compliant in terms of documentation, like policies, risk assessments, et cetera, any safe working practices that you have to document. But interestingly enough, now the emphasis now is not having reams and reams of paperwork to demonstrate that you are compliant. And as I spoke to a HSE inspector fairly recently, who said, the emphasis now is, he says he actually cringes when he walks into an organization that just has files and files and files of a health and safety, because he knows that nobody would look at it and nobody actually takes any relevance to it. What they are looking for is how those control measures are actually managed physically, and there's evidence that they can see physically that people are working to these control measures and are taking safety seriously. So they're looking at the practicalities and the actual doing of something as opposed to the documentation. It doesn't take away that you have to be documented, but ultimately it has to be seen in practice. And then the third point there is obviously safety learning solutions. It's looking at, part of the management regulations of health and safety is making sure that you instruct and you inform your staff in terms of what's relevant for them in terms of health and safety. And not just in terms of any formal training, but just in general, where is information? Where can they go to? Where is that central hub, if you like, where they can access and update and upskill themselves in terms of where that information is. So more and more it becomes more important that the leadership make this more transparent so everybody can see what the health and safety concerns are within your organization. And again, it goes back to that final point about reinforcing those values. If everybody's got this buy-in to the value of putting safety first and creating that culture, and not feel that it's them and us, or it's one person's responsibility. It isn't. It's everybody's responsibility, and it's everybody's need and everybody's desire to make sure that that culture is embedded within the organization. I think it's fair to comment here that what we're talking about in a lot of organizations is change management, and any change management within a business needs to be done so in a structured manner and in a proper way. You can't just put a flag in the ground and say, okay, from this day forward, we're now creating this safety culture and everybody will work this way. Because yourselves as business owners, any change that you try and implement within your business is going to be met with a variety of reactions, be it resistance, be it welcoming, be it somebody saying, no, I don't change, I'm not going to do it this way. So there's all of these things that you need to factor in when you're considering about creating this culture in terms of where you need to go within your business to make sure that you're putting the right systems and processes in place, or you have those systems and processes in place that will enable you to move this forward. And the buy-in side of it is probably one of the biggest challenges that you'll find, depending on the size and the makeup of your organization. Okay, next slide, please. It was interesting, one of the surveys done by the Risk and Safety Compliance Survey 2020 this year, and this was more bore out of the pandemic in terms of where business owners felt that the biggest concern was in terms of risks for the organization. And you just see there that 90% is mental health and particularly to remote workers. And I think we did a webinar about mental health and about work-related illnesses. And, when you look at in businesses, I think the statistics said work-related illnesses and absenteeism was attributed to stress, anxiety, and depression. And so clearly 90% is a big concern. And when you look at, it was 52% of illnesses across the business sector is quite a high percentage for mental health. It's overtaken that of the physical health hazards that we would traditionally associate with health and safety. So everything has come into this. So even, as I said to you before, even those businesses who consider themselves low risk in terms of the physical health and safety, the mental health issue now just amplifies the need to have this safety culture in place now, and to make sure that you've got the right kind of provision in place that will encompass health, safety, and the well-being and the mental health of all your staff. So you need to factor that in. And just because COVID is sort of going now, and you may have workers who have been working remotely who have suffered mental health just by them walking back through the door back into work, doesn't mean that that mental health issue has gone away. If anything, it might even make the thing worse. So you need to be really, really careful about what control measures you're putting in place, what you need to do in terms of ensuring that you're catering for those things that might crop up. And as I say, it might be now is the right time to start embedding this sort of culture that you want to create, to make sure that everybody feels comfortable and everybody is appreciative of the health and safety needs are being met for themselves and for others within the workplace. Could you go to the next slide, please, Dan? Okay, so understanding the climate. Again, it goes back to this leadership, and there's a lot of things that take place in organizations where in top management, there's this perception that the safety culture does exist as you perceive it, but it might not actually translate in truth, because underneath, if you looked at that, if that was a pyramid, shall we say, and the top is the safety culture that you can be seen, the things that aren't seen is how do people behave, how people are actually behaving, and what the organization really does and what it does actually provide to facilitate this safety culture. So you need to make sure that, you are putting those things in place. And remember that the safety climate relates to how the workforce perceives the way things are being done. So you need to put those checks in place. We've started working with a number of clients now who have embedded this, who are really, really buying into this now, this safety culture. And it's great to see that they're using, they're large enough to do it, but they're using committees and such like to represent the whole cross section of their organization. And by doing so, they're getting the right information, and they're able then to react and act and plan for further improvements to make sure that whatever it is they perceive they want to do and what their intentions are actually being met. And then they put those measures in place, and those, if you like, those key performance indicators, to make sure that they can not just tick the box, but they can actually see that their strategy is actually coming to the fore. Could you just go to the next slide for me now, please? So when we're looking at creating this safety culture, and when we're looking at what we need to do to try and see those tangible benefits of having the right safety culture, if you look at the top, those arrows at the top, these are the areas where you need to focus and concern yourself in terms of saying, okay, what do we need to put in place? What measures, what key performance indicators do we need to put up here, in terms of group and organization, in terms of leadership, in terms of what we've got in terms of our systems to manage the health and safety? What policies and procedures do we currently have, or what do we need to adopt? How are we going to engage? How are we going to involve the workers so everybody has a say in what we do in terms of safety? That way, then everybody can then get, where we can see where that sense of ownership is coming from. But let's not lose sight of the fact that, job stress and burnout and pressures that may exist, how they are going to be managed as well. And that all feeds in then to actually if you like, the melting pot of your organization in terms of how you're going to move forward with this safety, creating this safety climate. And then what you're looking for coming out of that is, obviously, you want to see the evidence of good safety knowledge. You want to see that everybody is motivated in the same way in terms of wanting to make sure that health and safety is at the forefront of what you're doing. Obviously, compliance is important. As a business, you need to make sure that that is there. And then, of course, lastly, is then how you're making sure that employee engagement is being met. Obviously, the benefits speak for themselves. By creating the right culture, you're going to get fewer accidents, and certainly near misses can be recorded. You're going to get improved health and safety performance. And like I said right at the beginning, it will improve morale. It will benefit your business, and you'll see a benefit on the bottom line to this as well. So this is, in a nutshell, what I'm saying about creating the right culture and the right climate for health and safety. But what I will say is what is important is it doesn't have to be a complicated process or system. If you're a small business or a relatively small business, it can be very simplified, you know, and it doesn't have to be a standalone sort of system in terms of making sure you're creating this culture. It can be integral with other systems that you have in place, or systems that you have, management systems that you have, and you can adapt this to it, so it's not a standalone. It is there for you. That really, in a nutshell, is what safety culture is about. And as I say, that last slide that we'll keep on there is every business has this. Every business has those 7 points at the top there. So you need to look at that, and you need to factor that in and say how you're going to cope with that and how you're going to manage that in terms of creating that right culture that you're looking for. That, as far as I'm concerned, is said, you know, from a slide point of view, is what I was going to go through. I'm more than happy now to open that up, or Vic, if you've got anything that you want to add to that. But I'm quite happy if we've got any questions to start taking the questions off the floor.
Yeah, so thank you very much, Colin. That was really, really insightful, very interesting, some really interesting stats there as well. And, you know, yeah. I think both agree in terms of the importance of creating that safety culture rather than just a compliance tick box, which I think when we've spoken to lots of new clients and sort of colleagues, that's what they've had. You know, I being one of them at one point, just happy to going, all right, well, I've got my compliance, I've got my risk assessments, they're all in a folder over there. And it's that point that you made then, you know, that, well, they may be there, but how are you actually pulling that together? And that sort of leads me on to my first question, really, just around, you talked earlier about the sort of the difference. Well, you mentioned about a near miss and an accident. So I just wondered if you could explain the difference between the two to the audience. And the reason for my question is that I was involved in quite a large European rollout of, they were trying to look at embedding a health and safety culture across the whole of the organisation. And when the auditor came in to do the initial internal audit, his criticism of the business was that they didn't have enough near misses. So if you could maybe explain the reason behind that, that'd be really helpful. Yeah,
I think traditionally there's been a resistance. I mean, essentially a near miss compared to an accident is a near miss is something that's occurred within the workplace, but didn't actually result in somebody getting injured, but has the potential of. And because of that, people or businesses see the negative connotation towards that. But in truth, what you're looking for is that actually helps recording near misses. So incidents that have happened actually is a very, very positive thing with regards to health and safety. And I personally would rather see a list of incidents or near misses that have happened, because it shows to me that it's capturing what's actually working or what isn't working within the organization. So, you know, near misses really should be seen as very positive, because it will enable the organization to make the changes that need to be made to ensure that safety is improved. But also it's a constant reminder for people. So if there's a near miss, they say, we're going to record that. And then all of a sudden they can see that and think, hang on, what are we doing wrong here? You know, what changes need to happen? And if everybody gets used to the idea of recording near misses, and then that information is then used, it's a very, very positive thing.
Thanks, Colin. And I think it's that point as well, isn't it, of getting to that interdependent stage, you know, where you're not just solely reliant on your health and safety consultant or your health and safety committee. You've got everybody within the organisation thinking about health and safety at all times.
Absolutely. And that's what I'm saying. So if near misses are seen as a positive thing, and everybody has a hand in recording those, it's that constant reminder, and it is that information, as you say, to make sure that your improvements and whatever changes need to happen can happen, and they're happening for the right reasons, not just because somebody perceives it needs to be happened. It's recorded and it's there. It's evident that it needs to happen.
Yeah, so great. And just I put in the chat then as well, I think when you put in, you mentioned the stats, I've always known that mental health is something that we should always consider, and it's been significantly again in the spotlight over the last 16 months. But to see that the sort of statistics that 90% of the risk now is mental health at home, it brings me on to sort of the question around people working from home. Some have worked from home for 16 months now, potentially looking to return. And 1HR did a recent poll. I'm not sure if you're aware of the figures, Colin, but I thought I'd have a little look before the session today. And it was really interesting, the split of how people felt. So we asked people, how do they feel about returning back to the workplace?
I did see that.
Yeah, did you see that sort of that 31% were saying that they wanted to return and they couldn't wait? Yeah. 29% were saying that they didn't want to return at all to the workplace. And then the remainder of the results were quite mixed. So 17% feeling apprehensive about the idea of returning to the workplace. And then 23% saying that they only were happy to return if they felt safe. Yeah. So what advice would you give to obviously our clients and members of peopleHUB of what they should do to try and provide that reassurance if they are intending to bring people back to the workplace now?
I think the difficulty is, I think everybody's been waiting with bated breath on Monday to see what the government guidelines were going to do and what they were going to change. And I think they've, not unsurprisingly, they've put the onus back onto businesses really and organisations to say, well, it has to be a common sense approach. So it leaves it quite subjective and quite open. And I think you've got to look at it from your own organisation and your own people. But I think the key thing here is if you feel it's relevant and if you feel it's appropriate to have those, speak to your people who are coming back into work, have that consultation with them, have that dialogue where they say, okay, where is your reservation? What is your problem? And it might well be that your organisation just says, well, okay, we'll maintain our cleaning stations. We will continue to wear masks in close proximity of each other or in communal areas. And it may well be that you might have to put additional measures in place. I think it's like anything else. And if you approach it like health and safety with anything, is if it's presenting itself as a risk, and people feel that their risk and their health is endangered or is at risk, then treat it like any other risk assessment and say, okay, what control measures do we have to put in place to ensure that our employees do feel safe when they're in work?
Yeah, I think it does. We've said this all along, haven't we, during this period of time, that communication is absolutely key.
Oh, massive, yeah.
We joke about it in the office, but when I went back to the Manchester office, I clearly was anxious about that. And, I got off at the wrong station and I couldn't remember the PIN for my card, and just because I'd not done it for such a long time. So I think we've got to take that into consideration, haven't we? A lot of us have maybe been fortunate to have some sort of hybrid type solution, but lots of our clients, they haven't been back, they haven't set foot in the office for 16 months. It's a huge change for them to have to make again.
Yeah, and I think the thing is, the stats that you looked at, I think was it 31% said they can't wait to get back to work, or whatever, was it 29%? There's also, just because of those people, and you speak to your staff and they say, oh yeah, I can't wait to get back into work. You've got to realize that some of them are saying that because they think that's what you want to hear. Mm-hmm. And, the reality of it is they're probably quite apprehensive about coming back to work for whatever reason, from a practical point of view, as much as a COVID point of view. There's, as you say, there's been an extended period of time, and it's almost like that they've frozen into that way of working, and that is their way of working. It was quite interesting because I was thinking about when we're looking at culture and looking at changing cultures. I remember years and years ago in my management development days when we were talking about change management, and we looked at a model as part of implementing change, and it was the Kurt Lewin's model. I don't know if anybody's ever heard of Kurt Lewin's, But basically, he very simplistically looks at it as unfreezing, changing, and refreezing, and that's how he modeled it. So you have to unfreeze people in terms of, you know, what they're used to, how they're operating, how they're working, get that buy-in to what you're trying to do, and then, you know, transition them into the second stage of making that change. So you're embedding what it is you're trying to achieve, and the changes that you're trying to implement, and so on and so forth. And then the last phase then is, at the right point, is then refreezing them into that. So they've bought into it, and they're operating as they want. And you know, it's exactly the same for this culture change as well. But I think now businesses are probably ironically in a really, really healthy position when people are coming back into work to think about health and safety, think about their well-being, think about the mental health, and creating that culture that will embed that and make that transition that much easier when people do come back into work.
Yeah, absolutely. And that, I suppose that leads me on to, obviously you've got thinking about mental health, talking about safety culture and good communication, but as we always say, it's really important you must have those foundations right. And even though we're saying don't just have them sort of in a cupboard somewhere, they need to be there. And I was talking to one of our clients yesterday who's an insurance broker, and he was terrifying the life out of me, really, because he was telling me how he's already seen, but he anticipates there'll be a lot more civil action against employers, because obviously, you know, fines are a way to recover some of this debt. We've seen it on the employment law side with employment tribunals increasing more than they've ever increased before. So I also saw some of the figures around Oak Furniture Land that was obviously public recently. They were fined £400,000. And when looking at that, my understanding was it was from, you know, poor risk assessments, documentation.
Yeah.
So what's your advice, Colin, to everybody today? Because, you know, there is that likelihood there will be spot checks. What should we have, you know, as a basic minimum when we're returning back into these offices?
Well, you need to revisit, because if you've made any significant change to your business, that's going to affect what your policy, your health and safety policy looks like. It's going to change what your current risk assessments or your control measures that you've got in place. Because if you're shifting the business back into, if you like, its normal state, but you've had risk assessments to cater for a more tailored, then, you know, that change would then insist that, or that change would then make sure that you have to make those risk assessment reviews. So from a compliance point of view, everything has to be updated. Everything will have to be revisited and updated. And, you know, you may have already done it, but especially if people are coming back in from remote working and then coming back into work, then yeah, you need to revisit those risk assessments, most definitely. And as what I said at the first point, so this should be seen as a very positive opportunity for creating that right culture. So everybody has a buy-in to that, and everybody has a say in the risk assessment and say in how health and safety is managed. So yeah, you're right in saying that. You know, the HSE are not going to go away. You know, they are always going to be a constant. And I think I share the insurance broker's point of view by saying that, you know, just because COVID's gone away, I don't think the HSE are going to water down their inspections. I think now they've been out there, they've had an opportunity, probably more than ever before, to say, okay, yeah, we can widen the net here now and start looking at businesses, and, you know, okay, where we've looked at where they were COVID safe, we can go back in there to make sure that they've updated their systems and updated their risk assessments and updated their policies to reflect what's happening now.
Yeah. Absolutely. Because I am, you know, obviously with us having the health and safety offer and solution that we provide now, I am quite shocked when I talk to businesses, particularly office, you know, professional services in offices where there's this sort of assumption that they are low risk, that, you know, they're sort of immune to all of these requirements, and that sort of you know, that viewpoint that you only need a risk assessment once a year, and as long as you've got that and you've ticked that box once a year, that you're okay. So I think that's a really crucial point that you make there, Colin, that, you know, if there's ever a change, then there needs to be those revised risk assessments and potentially policies as well to sort of to reflect those changes.
Absolutely, and that's why, you know, as you know, that's why we've been doing what we've been doing with our clients, is just giving that, you know, just giving that spot check and just making sure that they're, you know, identify where the potential gaps are, so, you know, we can help them become more, you know, more compliant, if you like. But I think now, based on what we're talking about now, is the opportunity of creating that culture. I can't emphasize as much now as that, you know, there's a definite shift now. There is a definite shift towards the, if you like, the powers that be, that they want to see more and more businesses demonstrating a safety culture, as opposed to demonstrating that they have files on a bookshelf or on a computer that says health and safety on it. They want to see physical evidence that there's this real buy-in to health and safety culture within businesses.
Great, thank you, Colin. Now, is there anybody that, I can't see any questions in the chat, is there anybody that would like to ask a question? Don't worry, you don't have to if you don't want to, but anyone got anything that we've not covered today, or that you're a little bit concerned about? No. No, well, Dan, this was probably a nice time. Obviously, I know you're very proud of. If you just want to put the next slide on, this is something that it's also Dan and the development team have been working really hard on, and obviously through Colin and his input's been fantastic. But we have recently launched OneSafe as well. So if you are a client of OneHR or you're a client of HPC, you may have received a contact from us recently just letting you know about this. So it's just to the point that Colin made before. So if you have got sort of risk assessments or documentation in different places, whether it be on the computer or sort of paper files, then we have got a feature now. You can have it on its own. You don't have to have OneHR, where you can actually pull all of this together. We've actually taken this a bit further as well to help you to create that culture. So it does provide you with that support to make sure that tasks, you know, you're reminded of things that you need to do. Key stakeholders have that involvement, everything's stored in the one place, people are trained. So it's you know, we're very proud of it. So if anybody does want to have a chat to any of our team about it, then please do. We will drop you an email after this. You know, by all means, let us know and we can provide you with a demo. Thanks to our team at OneHR and obviously our expert Colin. I think that is pretty much, if there's nobody who has any other questions, I think that is pretty much the end of the session. But one thing I would just mention, obviously this is a health and safety session, but they are aligned, you know, and we are a HR and health and safety provider. So if you are one of our HR clients as well, not only if you are bringing people back into the workplace and it is slightly different, you might have to make some contractual changes. So please do reach out to your consultants if you haven't already. Have a chat about that with Colin. That's the idea of us being able to provide that holistic approach now to our clients on both the HR and health and safety side. We do, as you know, this is the peopleHUB. This is one of the series of our events we do sort of on a bi-monthly time. Hopefully we'll be able to do some more live events soon. We used to hold them in Liverpool and Manchester, so watch this space. I'm hoping to be able to be in a town near you soon so we can all finally meet again face to face, which would be fantastic. But we will keep some of the webinars running as well, because I know they've been really useful to a lot of our clients during this time. The peopleHUB is an opportunity for us to come together. The idea being we're looking for like-minded HR professionals, business owners, health and safety professionals, people that would really see the value in coming together as a community. And when we do meet face to face, you have got that opportunity to network with one another and just share best practice and ideas. So if there is anyone else that you would like to invite to our next peopleHUB, or there's a particular topic you'd like to see that we've not covered yet, please do drop us a line. Dan will provide you with those contact details afterwards. But thank you so much, everybody, for joining today. It's great to see you, and I look forward to seeing you all very soon.
Thank you. Bye-bye.